good afternoon, or in some cases, possibly good morning to you. I'm Tony Puente, a 2017 president of American Psychological Association and a new board member to the American Psychological Foundation. Delighted to be with you today to share some ideas about the kinds of fascinating work that some of our APF grantees have been doing. So we're very pleased to have with us today one of our more illustrious, even though they're all great, this is particularly illustrious grantee, Dr. Luz Garcini. She has received a degree from San Diego State University and a UCSD, a joint program in clinical psychology with a focus on behavioral medicine. She also has an MPH as well and is currently assistant professor of psychiatry at the University of Texas School of Medicine in San Antonio. So we're delighted to have you join us today. I know that we have among the folks listening in, Luz, folks from as far away as Europe and as important as the most recent past president of APA. So we're looking forward for you to enlighten us on this very important and timely topic. Once you finish your presentation, if the opportunity arises, we'll take a couple of questions. And of course, more than happy to receive any questions that you have online, and we'll be glad to get information back to you. So with that brief introduction to our grantee, Luz, por favor, gracias.
Gracias, Tony. Thank you for the kind introduction. I am going to talk today in a different way than I usually do in academic presentations. Most of us have been bombarded lately with statistics and numbers of all kinds. So I'm going to stay away from that today. Instead, I want to transmit a message that I hope can touch home, build hope, and invite a call to action. We are living very challenging times in many ways. The public health threat of the COVID pandemic, its economic consequences, and the widespread divisiveness in our country are triggering panic and distress among us. There is no doubt that all of us, in one way or another, are facing some form of hardship. As a result, most of us are now in touch with the uneasiness that comes with uncertainty. That uncomfortable feeling of not knowing what is going to happen or when this frightening time might end. Many of us have felt the exhaustion that comes with trying to stay afloat and put a good face for our loved ones, even when we don't fully understand how to do it. For some of us, it might be the first time that we experience how it feels when another person in the street wants to avoid us or are afraid of being near us, or when people look at us in a different way that we quite don't know how to describe, but that makes us feel uncomfortable. Many of us are frustrated at the conflicting information that we are being presented by the media. Decisions that are being made often seem to be reactive rather than make any sense at all. We worry about our jobs and our finances, and most of us have started to restructure our budgets. I ask you to take a moment and reflect on the many stresses that I just described and think how they might be affecting you. Now imagine how would you feel if you were to double that stress or even more exponentiate it. The distress that I described to you is the daily bread for many, if not for most, undocumented immigrants, mixed status families, and their communities. This is what these immigrants encounter every day, with or without COVID. And they have done so probably for a very long time, even before their immigration journey began. A journey in search not only for a better life, but most importantly, a journey for survival. The conditions in many of the sending countries where these immigrants come from are devastating. And there's a lot of trauma among them. Yet, that does not stop them from leaving what is familiar to them to embark in a journey of uncertainty, all in search for safety and security. Most of you watching this webinar understand the toll that toxic stress, such as that encountered by these immigrants, can have on their physical and mental health over time. From the physical health perspective, we know that chronic stress reduces the capacity of our immune system to fight off illnesses, particularly infectious diseases such as COVID, and to have more severe courses or complications from the disease. We also know that chronic stress can lead to inflammation in the body, which has been associated with various chronic health conditions. From a mental health perspective, we know that chronic toxic stress can exacerbate trauma-related symptoms, lead to severe depression, debilitating anxiety, and diminished level of functioning that can contribute to disability, job loss, interpersonal instability, and other severe effects. Indeed, given their high exposure to chronic toxic stress, trauma, the harsh living conditions that they face, and their limited access to resources, undocumented immigrants and their families are at high risk of experiencing many of the negative health effects that I just mentioned. Yet, there is something very special about these immigrants. Their privilege does not come with a big house or a fancy car or a white-collar job. Their privilege is something that they carry in their veins. It is the resilience with which they face hardship and uncertainty that makes them so special, and a group that can teach us many lessons as to how to navigate the current uncertainty that we are all experiencing. So how it is that undocumented immigrants endure chronic stress and uncertainty in their everyday lives? Even in the face of COVID, they still keep going. How do they do it? I'm going to share with you some quotes from a study that was made possible through the generosity of the American Psychological Foundation 3 years ago, and which I find to be particularly relevant at the moment. These findings are presented on a paper that is currently under review, and it bears the title, "It's in Our Veins." This paper outlines various attributes or skills that undocumented immigrants have and use to cope with adversity in the face of uncertainty. The main dispositional attribute identified in this study is their ability to engage in cognitive reframing. That is, their ability to shift their mindsets and attitudes in order to see things in a new, more positive light, which facilitates their adaptation to difficult situations. So let me describe to you what this looks like to them. And Helen, if you can please help me share some of the slides.
Yes.
That I have.
Should be up now.
Yes. So the first one, it appears in the form of relentless optimism, which an immigrant described with a quote. It is about believing that life goes on and that it will get better. Whenever a door closes, I look to find an open window. Hope is our friend, which mitigates our sorrow and enlightens our path. The next slide shows us about the perspective based on relativity, or the ability to consider or see things or events relative to a frame of reference. Most of the time, viewing life through the lens of a past difficult moment that they were able to survive. This quote sums it well. Even if I struggle here, it's 1,000 times better than when I was in Mexico. It was so bad there that it cannot be any worse now. For them, sometimes remembering the worst of the worst scenarios helps them find comfort in the present moment, which is usually the opposite to what most of us do, in that we tend to fantasize about the past as being better than our present. Yet, we selectively forget about the worst scenarios from our past and how we overcame such difficult moments. Next, we have the concept of impermanence, or I believe that situations are not everlasting and that change for the better is possible. An immigrant described this as follows: even though it's difficult, unbearable at times, things will change. I know that things will be different, even though it doesn't feel like that at the moment. Next, another very important factor is spirituality, the belief that they can be strong in the presence of God. I know that I will hand it over to God. I'll let it be what it's supposed to be, and I won't let my mind be bothered for it. In addition to these dispositions, these immigrants also have attributes or skills that help them cope with distress and uncertainty, such as the tendency of an unconditional disposition for tenacity or willingness to endure hardship in order to achieve a desired goal. In this regard, an immigrant said, "We are very strong. We are people that know how to stand up in the face of difficulties. We know that where there are difficulties, there are also possibilities, and we carry that in our veins. We don't give up easily, regardless of how difficult our lives are. We need to remain strong. With enough effort, anything is possible." The next is flexibility, or their ability to change their behaviors to adapt to changing situations in their environment. And the quote reads, "Whatever comes my way, I am here. Give me any work and I will do it. 3 a.m., with cold, hot, danger, whatever it takes, I will figure it out." And last but not least, they have fortitude, which, although similar to tenacity, it refers to this immigrant's fearlessness and ability to be realistic about the hardship to be faced in working towards the ultimate goal of achieving a better life. Not being afraid is an important value. I am going to start from zero. I am going to face hardship. I am going to face risks. I am going to face hunger, but it doesn't matter. I am going to do it. I am going to try. I have to do it. So this is the sum of the many ways in how these immigrants put one foot in front of the other, even when they don't know where the road might lead them or what might happen to them or their loved ones. These are their superpowers. So now I ask you, what are your superpowers? Are the superpowers available to these immigrants also within you? Do you carry these superpowers in your veins? I believe everyone does, although sometimes we forget. So I invite you to look around and in your everyday life, and any time that you encounter an undocumented immigrant, whether in the street or at work or in the community, they are everywhere, that it serves you as a reminder of the superpowers that we are all endowed with. These immigrants are role models of determination and courage. But in exchange for that reminder, let's treat them with the kind and respect that they deserve. Unfortunately, we are living in a time in which there are polarized views on immigration and widespread anti-immigrant rhetoric that is harsh and unacceptable. Immigrants are being stereotyped as a danger to society, as a threat to our economic stability, and more recently with this pandemic, as a public health hazard because they are being portrayed as disease carriers. Stereotypes of immigrants abound, and there is a poor understanding of who these immigrants are and the harmful causes that force them to migrate. As the COVID pandemic evolves in the US, we have seen numerous actions being taken against these immigrants. To name a few, There are over 800,000 DACA recipients that are awaiting a Supreme Court decision that might revoke their protected status in the midst of the pandemic. Even though over 27,000 of them are healthcare practitioners supporting occupations on the front line of the COVID response. There has been a surge in the number of deportations of immigrants detained at border stations without regard to a fair migratory process and in violation of established migratory agreements. We know that there even have been cases of unaccompanied minors who have been deported alone. Court hearings for immigrants awaiting in Mexico for US asylum under the Remain in Mexico program have been suspended, which has left thousands of immigrants stranded at the border, living under very dangerous and unsanitary conditions. There has been limited action taken at ICE detention centers to protect the health of detained immigrants and consider their temporary release to their families so that they can engage in safe social distancing practices. These not only endanger these immigrants, but also all of the people that work at such facilities and their families. We know that undocumented immigrants are being excluded from the CARE stimulus package aimed at helping to ameliorate the economic impact of COVID, including their US citizen spouses and US-born children. Yet, we hear that these immigrants are part of the essential workforce that is keeping our country afloat during this pandemic. I could keep going with examples of the many actions that are being taken against these essential immigrants, but I'd rather focus on making a call to action. People often ask me, I don't know how to help. What can I do? Here are a few of the many things that you can do to help. Each of us has access to different platforms depending on our area of expertise and the job that we do. Whether it is in academia, or at medical centers, or at organizations or leadership boards, or in your community, use your access to such platforms to give a voice to the many immigrants that have been voiceless for so long. Remind people about core American values and make a call to stand for social justice and defend the dignity and human rights of all people, regardless of their immigration legal status. Invite people to engage in respectful dialogue about immigration that can help us find practical and proactive solutions. Let's not continue to reinforce anti-immigrant rhetoric. Let's build better ways of communicating and talking about people, particularly the most vulnerable. Keep learning about our immigrant communities and disseminate information that can help debunk existing stereotypes about them. Help others understand why these immigrants are essential. And I am not only talking about their labor, but rather about the tremendous life lessons that they can teach us. Support immigrant efforts, whether directly or indirectly. Use your backgrounds or skills to serve or to inform the needs of different immigrant organizations. There are many and they are everywhere. Or provide pro bono services for some of these immigrants. Support the efforts of students or young people who might come to you and say, I want to study or work with immigrants. Even though this might not be your area of expertise, help them figure out the way. With your support, they can do it. I did it because I had mentors who did this for me. We need to plant the seeds to build a workforce of future professionals and clinicians equipped to work with these immigrant communities. Help us build that workforce. Assist in research efforts. Knowledge about undocumented immigrants and asylum seekers continue to be limited. We need a lot more information. This information is essential to inform interventions, advocacy, and most importantly, policy efforts. And last but not least, become a role model in your everyday life. Set an example for others. When you encounter any of these immigrants, treat them with kindness and respect. Give them a smile, show your appreciation, And if they need help, lend them a hand or an elbow shake right now. Remember that our younger generations are watching. Let's bless our future generations with this gift. Let's teach one person at a time about the importance of treating all people with dignity and respect. And let's start with those that need us the most right now. In closing, I want to remind you that these immigrants are essential to us and we are essential to them. I believe that if we use our superpowers to support those of our immigrants, we will overcome divisiveness and the many challenges that we are facing so that we continue to build an America where dreams can become possible. Thank you for gifting me with your time today, and I want to spend the rest of the time listening to your comments or your feedback or your questions or any other information that you would like to share with us.
Thank you, Luz. Wonderful and inspiring, especially during these very dark times. So if you have questions, we encourage you to please place them in the chat box and we will attend to your questions as best as we can. But I'd like to start off by asking you a couple of questions as we give our attendees the opportunities to ask the questions themselves. And that is very specific to you. How is it that the APF assisted you in getting off the ground? What is it that you asked for? What was it that APF provided? And what was the outcome of that? I know this is not a research talk, but could you give us a mini version of that?
Oh, absolutely. And I don't even know where to start because there's so much about that. For me, I think it was the first sign of hope. When so many doors closed to me for studying undocumented immigrants, as you can imagine, the minute that you want to study undocumented immigrants, people become hesitant, particularly about funding something like this. And I found hope on APF when they trusted with me with my first grant, which was the Barlow grant. And they put in my hand the ability not only to give a voice to the voiceless, but also to build a team of seeds that allow me to start training students. So at that time, I had a team of 13 students, all of who now have gone to different careers. Some are pursuing medicine, some are pursuing psychology, some are pursuing law, but every single one of them is focused on studying the immigrant communities that are most vulnerable. So I think the impact that APF has gotten on my career has been at multiple levels, and not only to benefit me and the information that we're producing with all of this research, but also the workforce that we're preparing to follow our steps when we're not here, along as a community, giving a voice to a community. All of the work that I do, any manuscript that gets published, any findings of the study, I take back to my community partners and present to them. And they know that the American Psychological Foundation was interested in them.
Thank you. Now, I have a question from one of the attendees, Doug Kimmel. He says, one thing I can do is write a letter to the editor of my local newspaper. And by the way, I might add to national newspapers as well. What are the important points or a particular important point I should stress in my rural area?
Yes, I think that anything that we do needs to come with what I call formative research. So I would say that because the situation on each community are so different, they vary depending on the state, on the nearness of the border, on the political orientation that might be at that state. I think it's always important to make a few calls to your partners or to leaders in your community that represent the population and ask them, what are some of the challenges that your community is facing? What is the current situation in our state? And then take those findings to write about it. So it's a partnership between using the knowledge that the community have and the expertise that you do to bring it forth and make an advocacy.
There's been a lot of question recently. In fact, those of us involved in advocacy within APA are very in tune with the difficulties with the COVID crisis, as it particularly affects people of color. We have also noticed this is with the Hispanic or Latinx community, and most recently, some startling findings with Pacific Islanders. What is going on that these targeted groups, which by nature are immigrants, have taken the brunt of this very difficult situation?
Yes. So if we approach this from a health disparities perspective, we see that, what is happening with the current pandemic is that these disparities are becoming magnified. So we know that there's socioeconomic disparities, right? We know that 80% of Latinos do not do jobs that can be done at home. So they have to go and be at the front of those, whether it's as working in supermarkets or working in the fields or working in construction, a lot of them without any protective equipment. So socioeconomically, I think the risk factors that are present there among many Latinos, are at the forefront. The second one, we have some of the highest rates of uninsurance. And with that comes access to healthcare. With that comes access to testing, access to the doctor if you start having symptoms. So a lot of people are deferring that. And until they get very sick, they probably attend the emergency room, and maybe that's too late for them to get any type of treatment of access. So that's another one. And another one I would say is the mistrust that our communities are experiencing right now. We have here, from what I have talked about this big anti-immigrant rhetoric that is happening. So people are afraid. Even people who have legal residency status say, what if I go and seek help or get tested and my test becomes negative and I become a name on a list? And later on, people can go and take my legal status out of that. So people are very afraid of speaking up or seeking services. And I think that is another one of the contributions that is leading to these disparities that we're seeing.
Thank you, Dr. Garcini. We have a question from one of the rising stars in psychology, hailing from North Dakota, receiving her PhD in counseling, is Ailey Carrero Pinedo, who says, good afternoon. My question is related to advocacy and undocumented immigrants. How can we use psychology and public health to inform advocacy decisions? For example, there's a group within APA called the Advocacy Coordinating Committee, and they're very concerned about how we make sure that this gets to the forefront of this concern. Suggestions?
Yeah. Yes, absolutely. I think we need to go back to the basics. And the combination between psychology and public health is like a magic wand. So one allows you to identify the strong points in which can increase vulnerability in the population. You develop those skills, and then public health, particularly from the epidemiology, gives you the basics so that you can make your inferences at a population-based level. So I say, when you're advocating, use mixed methods in your arguments. So we have a lot of cases, in cases, and qualitative data is very important. But a lot of the time, what move economics and politics is numbers. So we need to start conducting population-based studies that can help us inform and advocate for the needs of undocumented immigrants. But you're on the right track. You have the combination of both.
Well, let me ask a question for her. You were in her shoes not that long ago. How do you get a young person that has such difficulties, so many barriers? What recommendations would you give a young student who is interested in these issues? How do they fight the system to make the system fight for them?
Yes, I think advocacy getting involved in leadership boards, getting involved starting at the community is a good way to continue with your motivation, but also every single one of these undocumented immigrants or DACA recipients that goes through college is going to be a seed that is going to continue to do this work and is going to talk on behalf of a community. So they represented a community. However, I want to warn them that they need to take care of themselves. Focus on one step at a time. First is to get their studies. So, because a lot of them try to do too many things at one time and then they experience burnout. So I would say the first is focus on your career. The time will come for you to take a platform, and then you will do it because you were put in that position to develop the skills to achieve this.
Thank you, Luz. We have a question from the most recent immediate past president from the American Psychological Association, Rosie Davis. She has a question as follows. Any particular safety precautions researchers need to put in place in order to not further stress or endanger undocumented immigrants? And in fact,
Yes.
I'll ask another question on her behalf, even though she did not do so. And that is, when you finish answering that question, can you bring the interface between immigrants and poverty? Because as you might recall, that was Rosie's presidential initiative last year. So we got two questions for Dr. Davis, even though she only asked one.
Yes, absolutely. So let's hope I can remember and not forget the second one. So let me get to the first one. I think the first one is we have to, anything that we try to say or we try to convey, we need to go back to our communities first and ask them if this presents an accurate representation of their needs, of their concerns, and of their protective factors. Whatever it is, we need to filter them, because even if we have the best of the best intentions, we have bias embedded in us, in our lives, in our education, that can blind us to what that might do to the community. So I say the first step is to develop partnerships and work together to put the message together that can help us use the skills in the best way possible. The other one is, I think, going back to our basic core values, and our APA Code of Ethics puts them very clear. Trust your instincts, in terms of we know what's good and what's right. When something doesn't sound right, when something doesn't sound like you're respecting people or you're being kind to people, then take a step back and think about it a little bit more. And then the second question I already forget. So if you can remind me, Tony, that'd be great.
Very good. Dr. Davis's presidential initiative during her excellent year as last year as an APA was on poverty.
Yes.
Poverty initiative. Now, it might be interesting to note that last time APA actually had a policy on poverty was in 2000. So it's been so long we visit that issue. And one wonders whether Rosie's initiative on poverty interfaces somehow with today's COVID crisis. In other words, we know how many African Americans have died, so many, but I wonder about, is this hitting more a certain segment of the population that's socioeconomically compromised?
Absolutely. Absolutely. I mean, you're mentioning a very, very important point. And I can give you one of the recent examples that I was discussing a few days ago with a DACA recipient organization that I work with on behalf of the National Latino Psychological Association. And this is the case of DACA recipients. So I see, the mingling between socioeconomic status and education. So DACA recipients, as I mentioned during the talk, they're waiting to hear the decision from the Supreme Court to see if their protected status is going to be revoked or not. The biggest concern among these young, most of them very well educated, hardworking, good kids, is that their families will not understand their need for education when they don't have food in the table. So a lot of these families that have been hit by COVID are losing their jobs, are losing their income. So that will fall off the table. Basically, we think about Maslow's hierarchy of needs, right? When you cannot meet your lower needs, there's no way that you're going to start aiming for higher needs. So their concern was our parents, because they don't understand and are going to pressure us to go back to the field, to go back to do the jobs that they did when they came to this country. Because we cannot afford education, because they don't truly see that education is that key for social mobility that can pull us out of poverty and gives us access little by little to better and ways of living.
Gracias. From one of your colleagues, Dr. Manuel Paris. Hola, I appreciate Luz tremendously, as we all do. She is an amazing advocate. Una preguntica. Trying to figure out how to help sometimes feels daunting. Are there any particular organizations that you would recommend? And let me add to that question, any particular methods? Sometimes we feel like we got to change the world. Can we change just a little portion of that world?
Yes. Hi, Manny. Gracias. Thank you for the question. And I have to say, Manny has been Manny, Paris, Alfonso Mercado, and Melanie Dominic Rodriguez. We have made a team since this pandemic began to push forward and try to assist, our immigrants community in any way. So it has been a pleasure working and learning from all of them. But absolutely, I think we need to focus on little steps at a time, because if we try to do too much, it might feel overwhelming and it could lead to burnt out. So I think there's always things that we can do. And as I emphasized in my first step, I think we all have access to different platforms. It's almost like putting a t-shirt, and everywhere you go, you carry that t-shirt and that sign in the front with you, and keep conveying the message, and the doors will open. I do believe that there's plenty of organizations out there, but the psychological associations are fascinating, because we understand what the stress is like. We understand what happens with it. We understand what we can do about it. And we understand how to help people that are facing it too. So I think go to the different psychological associations within your state. I have found a home for me in doing undocumented immigrant work through the National Latino Psychological Association. But I know there's many of the local state associations that provide fantastic avenues. APA has many divisions that also do that kind of work. Division 45 is an excellent one, Division 35. So there's a lot, Division 38. There's a lot of places. Find one that you can feel at home, and find people. Don't try to do it alone. Find people that will help you row the boat. And for that, Manny, I thank you. Alfonso, I thank you. Melanie, I thank you.
Thank you. Now, this question actually comes all the way from Turkey. How should language and words be used to prevent discrimination and prejudice against refugee in the coronavirus process? Now, I want you to answer that question, not just from our understanding of how our life is here, but realize that Turkey is facing a major immigration crisis. And the person who sent us is the president of Mental Health for All in Turkey, who's been pushing real hard for the mental health, not only for citizens, but people who happen to be in internment situations. So take it away, Luz.
Absolutely. Well, first of all, thank you very much for dedicating us your time and coming to listen to this important topic. And absolutely, I know the situation that Turkey has faced in regards to immigrants. This is interesting. Language. Language is an interesting thing for me because I am not an English speaker. So I have to, when I convey a message, I think in my language, I feel in my language. And then I need to figure out how I can convey that same feeling in another language. But I try to go back to core principles and values such as kindness, generosity, doing what's right to anchor myself. My best friend is the thesaurus. So I go back and try to find the meaning that in my heart will convey across language what I'm trying to say. So it is not easy, but I think that if you operate from core values that bring the best in people, I think it is possible to bridge any language barrier. Did I lose them?
Yeah, no, yes, we're back. Yeah. I think everybody's trying to Zoom. It's difficult. The broadband can't handle all of us. All right. So we're very, very lucky that we've had, as part of the attendees, the president of APA. We also have the president and past president of APF. We're very lucky to have them. But we also have among some of the attendees, freshmen, students. And we have a question from one of them. And this person said, do you think that in this time of uncertainty, we will eventually establish better relationships between immigrants as well as the government? We've seen on the internet that the coronavirus has, in its own way, brought the nation together and increased a sense of support. Do you think that the same thing will happen to immigrants, including those who are undocumented?
I do. And I'll be happy to share some of the pictures on the slides, but I think this is the point where we go back to the superpowers. These immigrants have superpowers that come with or without COVID. So this is just one more thing for them. Yes, it's compounded stress, and that's why we need to stand up and take action. But these won't bring them down. They have an amazing ability to reinvent themselves and to stand up and move forward. So I think if anyone can do it at this time, is these immigrants. And this is when they become essential, like I said, not only because of their labor, but because of the many lessons that they can teach us as to how to live a life of courage and determination.
So what you're suggesting, that instead of thinking of immigrants as a load, as a stress on our nation, on our economy, we should think of them as a bright light, as a beacon of hope, as a group that has actually managed. As a matter of fact, I know this is not necessarily about you. It's about all of us, and all of us who are immigrants and all of us who are scientists. But could you just take a moment? How was it that you got to where you're at? Because if there was an indication of hope of our future, I think you're as good example as any. Would you prefer to share that with us?
Yes, so I don't know how many people on the call know my story, but I came to this country close to 27 years ago, and I came with literally no education, very young. You know, I married when I was 16. By the time I was 19, I already had 2 kids. Came without speaking English, with very little money, and not really wanting to leave my country. You know, there were certain conditions in my country that pushed me and my family to come to the United States. And we thought maybe it's just temporary until, you know, things comes down at home, and then we'll go back. And I never went back. Things were not easy at the beginning. You know, I was a high school dropout, so I wasn't even thinking about college. You know, I was thinking like many women in my family, you just marry and stay home and raise children. But this country does something to you. and this is why it's so important that we continue to support and build our immigrants, because the American dream, it is possible. And I'm a witness to that. So I was able to find the resources to start learning English, to do a GED. I mean, I don't remember how many years I went to the community college, because I found fascinating that there were all of these things that I could learn, and that I could learn English. And that after that, I found so many great mentors, and I call them angels, because all along my career, mentors keep appearing that trusted me, that I would come up and said, oh, I want to learn about immigrants. And they would say, well, I don't do that, but I can help you find the way for you to do it. Or I don't have money to fund those studies, but I can find you ways to do it. And I think it's just knocking a lot of doors and not giving up. And then it was once I started to connect to my community that I found a purpose and a meaning, not only in my career, but I think in my life. And then because my children, I will always carry them with me when I had to go to college, or whenever I was working, they were working there. Both of them saw the pattern, and they both became involved in, at first, similar careers. So my daughter is a clinical child psychologist, and she works with a lot of immigrant children. And then my son was working in political science, and for a while he was working at the Inter-American Dialogue in DC, which does a lot of immigration policy efforts in Central American countries. Now he has shifted gears a little bit. But I think that's the pathway, that it is possible if you're willing to knock a lot of doors, and they will open to you. And I would say the American Psychological Foundation was one of those, that when it opened, it did not open a little bit, it opened wide, two big doors. And it has made a big difference in my career.
An interesting question from Jeff Baker. He suggests that not just folks in this field should work with immigrants, but we should all be challenged. We should all be trained accordingly. So what are the challenges, and how do we overcome those challenges, not just for a small number of us who are interested, but all of us?
I love this question, because this is a tricky question. It comes from one of those mentors that I just spoke about. Dr. Jeff Baker was the one that put in my hands what I needed to make it to a PhD when I couldn't pass a GRE exam. And I was working with him at the University of Texas Medical Branch. And I remember I went to him and I said, there is a lot of undocumented immigrants that come through the hospital. Can I spend more time, in some of the units in getting to work with social work and everything? And he just said yes. He will give me the guidance. He will put me in contact with other people and says, Luz, go do it. So I think he's the one that has to give this advice, because he did it with me. But it's something that you feel. Is the support, and it's a constant, yes. I don't know the answer at the moment, but we will figure it out together. And I think if you have mentors who have willingness to do it, it doesn't matter the color of the skin. It doesn't matter their socioeconomic background. Sometimes it doesn't even matter that they are psychologists. They can be doctors, they can be attorneys, because studying immigrant health is a very interdisciplinary field. I think that with a good heart and a commitment to mentorship, anything can be done. And mentors are essential to make a difference, because I can tell you, Dr. Baker and Dr. Elizabeth Slonoff did it for me.
Dr. Baker, thank you on behalf of all of us.
Mm-hmm.
All right, so now you got a question from one, if not the icon in this world that you have jumped into. Dr. Olivia Espin. Thank you, Luz. It's great to see a wider audience and a larger group of psychologists doing this work of raising awareness and increasing data-based information while also providing support to these immigrants. It's such a long way for when I started doing this work in the late 80s and early 90s. I was told by several psychologists, and I wish you could tell us who those people were, but I shall not name, that working and doing research on immigrants was social activism and not scholarly work, and certainly not psychology or scientific psychology. I think this is a result of the seeds that Lewis was talking about earlier. And yes, language is more important than just translating or being able to communicate. Love your story. What do you say to an icon like that?
Thank you. Thank you for paving the way. Because we need to remember that right now we might be fighting the immigrant fight, but women who opened the field in academia back in the days when it was male dominated, opened it for us. So, I mean, we're not fighting very different fights. You know, same history with the African American community who's still fighting their battles, right? I mean, is this mentor, these icons that open the way to other disadvantaged or vulnerable populations to step up of the plate and do it. So it is because we have mentors who have walked the walk that we can do it. So thank you for that.
And she adds a couple of other quick comments before we go to a couple of final questions here. She adds, see by Making Love in English in Women in Therapy, 2012, and even an earlier book by her, Women Crossing Boundaries in 1999, both on language and sexuality among immigrant women. And also she adds, younger psychologists are indeed lucky that they have had access to mentors. And if there's one thing that APF is really all about, is making sure that that occurs. So thank you, Dr. Espin. From Doug Kimmel, who actually asked a very interesting question earlier on. He adds, thank you so much for this profound and very helpful discussion, beneficial for non-immigrants and for all of us in psychology, as well as outside of psychology, I might add, and the personal comments as well as helpful insights were amazingly insightful. From Esperanza Monterrubio, thank you for your personal witness to immigration and getting to where you're at. You are an example for many, including myself. Also for indicating that spirituality is essential for immigrants. Even with all the issues they have to get to the border, they're thankful for God and for the opportunity to arrive at the border and still with a future very unclear. For those of us in scientific psychology, we just don't think that spirituality should be part of the equation. Any comments on that?
Oh, absolutely. And I have to say that Esperanza Monterrubio is part of my family. So, and she is a leader. She and her husband and her entire family has been a leader and has been a lot of great groundwork in bringing faith-based organizations at the forefront of fighting the immigrant battle. So it's essential that any work that is done with immigrant communities has a faith-based approach. I would say that you cannot disentangle faith from immigrants. You know, it's in their veins, it's who they are, it's how they put a foot forward every single day. So it's essential that we start collaborating, talking, and learning from faith-based leaders and organizations to be able to do this work. And a lot of the core values, you know, the Bible has the fruits of the Spirit, right? Which shows us about what is important when we interact with people: gentleness, kindness, patience, self-control. All of that is embedded there. And I think these faith-based leaders and organizations can teach us how to better communicate and how to build resilience with these needed communities.
And maybe one last comment from one of the attendees today, Nabil El Goriri, who says, thank you for this inspiring presentation. And also, I think this is an important one that I hope maybe you can make a comment on before we say thank you to folks here. the focus on resilience is critical for examining immigrants. What do you have to say about that?
Absolutely. We need to stop pathologizing immigrants as a result of their environment. I think we need to adopt strength-based approaches. You know, it is only in that we will start to not blame the immigrant, but start to put the attention on the environment and what can we do to change the environment to protect what the immigrant has in their veins. So thank you, Nabil. Nabil and I worked for many, many years at the APA. So thank you for watching.
Well, one last question, maybe from the mouth of babe, from our youngest participant, I'm almost sure, says, I've always lived in the same part of the country, always lived with the same kind of people, never really had a lot of experiences. What was the most difficult thing that was for you specifically, coming from where you did to be where you're at?
Oh, that's a good question. I'm thinking, because there were many. I do think that, and it's still hard up to this day, learning to live in between two cultures. I think that's hard. Stepping out of my identity as Mexican, not even Mexican American, and then embedding the context, particularly academic, in which I live every day. So I think bridging that cultural gap has been very difficult for me. You know, I even experienced it with my kids. I brought them when they were 3 and 4 years old. So they see themselves more as American. So that has been one of the challenging parts. The language still, you know, up to this day, you know, I watch movies with subtitles, and if they're too fast, I lose it. After 5 p.m., I have trouble speaking English. The words just don't come, you know, and the older I get, the harder it becomes. Sometimes I confuse. I call man she and female he. I mean, it's. I think the language will be something that I will always struggle with, but you have to stand pride in who you are and embrace the journey, the acculturation journey, and continue to move forward.
Thank you, Luz. You've got many wonderful comments from folks from Europe. Dr. Schwartz says it's been truly meaningful and joyful. But also, I want to take a moment to thank the interim CEO of APF, who's really taken APF to new heights despite the most difficult circumstances, and whose idea it was to generate this lecture series during the COVID crisis. To Miriam Isaroff, thank you. To Dr. Keene, who's currently the president of APF, as well as the person who was responsible to getting you your grant, Dr. David Barlow, who was president of APF during your tenure. Thank you all for being here. And to all the participants throughout the US, outside the US, wonderful. This is what APF is all about, bringing bright minds with inquisitive ones to make sure that the world's a better place, because psychology was part of it. So on behalf of APF, Luz, un fuerte abrazo. Muchísimas gracias to all of you that joined us. Thank you very much. Continue good luck. And as we are starting to say within APA, don't physically distance.
Gracias, Tony. Un placer. Dios lo bendiga.
Don't forget all of us. We all have to be close to each other. Make sure that you stay safe and we make it through successfully. Thank you, guys. Buenos días. Hasta luego.
Buenas tardes. Bye bye.